Did you know that in 2024, U.S. healthcare organizations reported 725 major data breaches, each involving more than 500 patient records? That is the third consecutive year with over 700 large-scale breaches reported to the Office for Civil Rights, also known as OCR. These numbers are not just statistics, they are a wake-up call. They show that the healthcare industry is under continuous attack, and even small organizations are not immune. Many still think we're too small to be a target. But cybercriminals do not see size, they see opportunity. That is where the HIPAA Security Rule comes in. It provides a critical framework to protect electronic protected health information, or ePHI, from exposure, misuse, and unauthorized access. In this video, we are breaking down what the HIPAA Security Rule is, what it is designed to protect, who needs to follow it, and why cybersecurity is not just an IT issue. It is a compliance responsibility and a business necessity. Let's start with the basics. HIPAA stands for the Health Insurance Portability and Accountability Act, passed in 1996. It was created to improve the efficiency of the healthcare system while also protecting patient privacy. As electronic health records and digital communication became the norm, HIPAA introduced national standards to secure sensitive data. One of the most critical components of HIPAA is the security rule. This rule focuses specifically on safeguarding ePHI, which is health data that is created, stored, received, or transmitted electronically. The security rule sets standards to ensure three core principles are upheld: confidentiality, integrity, and availability. In other words, the data must be kept private, unaltered, and accessible only to authorized users when needed. These principles are more than ideals. They are the backbone of secure healthcare operations. So who is required to comply with the HIPAA Security Rule? There are two main groups: covered entities and business associates. Covered entities include healthcare providers, health plans, and healthcare clearinghouses. Business associates are any third-party vendors or service providers that access, transmit, or store ePHI on behalf of a covered entity. This could be a billing company, cloud storage vendor, IT consultant, or even a transcription service. If your organization handles ePHI in any way, you are expected to comply with the rule. So what exactly is considered ePHI? It is any individually identifiable health information in electronic form. That includes electronic health records, medical billing data, lab results, prescription information, digital imaging files, secure messaging systems, cloud backups, emails, and even texts containing patient information. If it relates to a patient's health, can identify them, and is digital, then it's ePHI. Now let's talk safeguards. The security rule requires organizations to implement administrative, physical, and technical safeguards to protect this information. Administrative safeguards include risk analysis, workforce training, and security policies. Physical safeguards cover access to facilities and devices. Technical safeguards include access controls, audit controls, encryption, and secure transmission of data. And it is not just about having these tools, it is about documenting them, updating them, and showing that your organization actively manages risk. That is where cybersecurity becomes essential. HIPAA compliance and cybersecurity go hand in hand. Strong passwords, firewalls, endpoint protection, regular audits, data backups, none of these are optional. They are compliance requirements. And the cost of ignoring them is steep. Non-compliance can lead to massive civil fines and even criminal charges in cases of willful neglect. But the financial impact is only part of the story. A data breach can destroy patient trust, halt operations, damage your organization's reputation, and require months or even years of recovery and remediation. The bottom line is that you cannot afford to ignore the HIPAA Security Rule. It is not just paperwork, it is protection. It is your blueprint for keeping patient data safe, your operation secure, and your organization in compliance. If you are working with ePHI and are unsure about your current safeguards, now is the time to act. Because in today's threat landscape, being unprepared is not just risky, it is a liability. If you'd like to learn more about strengthening your HIPAA compliance, reach out to K2GRC. And since you've made it this far into the video, you might as well like it, share it, and comment below.